Good afternoon, everyone. On behalf of the UMMC School of Nursing Board of Directors, I want to take a moment to welcome you to our event this afternoon and wish you a very happy Nurses Week. I am Dr. Tanya Moore, and I'm honored to serve as your board president, along with our dedicated board of directors. I want to extend a special thank you to the entire board of directors, and especially to our special recognitions team, as well as the Alumni Day Planning Committee, and Heather Pierce, who is our hospital liaison with the Department of Nursing Quality, Development, and Professional Practice at the UMMC Health Systems. Heather serves in the role of manager. We are pleased to serve all of our more than 7,000 alumni. And I just want to take a personal privilege to say it is truly a privilege for me to serve alongside of you. And when I think about the magnitude of the footprint that the School of Nursing alumni has placed across this globe, I am deeply honored. We have courage and bravery to step up and take responsibility and serve in leadership roles such as CEO, owners of our own clinics, very impactful roles in academia and health systems. And it is truly a privilege. So today we are going to sit back and we're going to honor a few of our distinguished alumni. I won't give you more details than it's coming forward. I now want to pause and ask that you receive warmly our Dean of the School of Nursing, and we're privileged to have such a visionary leader with Dr. Sanford. Dean Sanford.
Thank you so much, Dr. Moore. It's just a privilege to be with you today. It's an honor, and I'm really excited to recognize these two amazing people with the awards for today. I was asked to give a little bit of an update, and I've updated you in the last alumni meeting, so I will just share with you that our graduation and pinning ceremonies, they were going to be virtual, but with all the progression that we've made with the pandemic, we're able to have in-person ceremonies. So that is just a tremendous thing, and it's exciting for our students as well as the faculty and staff. When we come back into the building and see somebody, we're just wanting to run and hug them, even though we're all doing the social distance thing. But I'm so excited to be here today, and it's a wonderful honor to recognize all of you for your participation, and in particular, those two awardees. Thank you so much.
Thank you, Dean Sanford. Dr. Purnell.
Thank you, Tanya. Thank you, Dr. Sanford. As one of the privileges I have as president-elect of our Alumni Association is to chair the Special Recognitions Committee. In January 2020, our meeting, we decided to implement a new award called the Early Careerist Award. And the criteria of that award is it would be an MSN or BSN graduate from the UMC School of Nursing or the Oxford Ole Miss School of Nursing location. And it would have to have been, the person would have had to have graduated within 10 years of the present date when we selected that individual. Additionally, that person would have had to have made a significant contribution to nursing and or healthcare. And we made that recommendation to our full alumni board, and this was approved. So we polled the full alumni group and received several nominations. That was back in 2020 of January. Fast forward to 2021, when we collected all of the nominees, put them before the committee. One nominee stood out with very strong recommendation, accompanied by some outstanding letters. This was Dr. Kayla Carr, who's with us today. Kayla was unanimously ranked #1 by all members of the committee, and the executive committee of our Alumni Association affirmed her nomination. For those of you who don't know Kayla, she is assistant professor at UMC School of Nursing, and she leads the accelerated BSN program. Kayla is a family nurse practitioner at UMC School of Nursing school-based clinics. Her prior clinical work has been with the Mercy Delta Express Project and also experience at the Winford Weiser Hospital for Women and Infants there at UMC. At the time of the submission, I'm assuming this is probably grown by now, Kayla has 9 publications, 3 of which she is first author on. She is a PI for a HRSA grant totaling almost $1.5 million. In the past year, Kayla has received numerous UMC recognitions, including induction into the Nelson Order of Teaching Excellence, and she is a current fellow in the Dean's Emerging Academic Leadership Program. Kayla received her BSN from UMC in 2010, her MSN in 2013 in the Family Nurse Practitioner Program, both of those being from UMC, and she recently, where I met Kayla, obtained her PhD in nursing at UMC School of Graduate Studies. In her recommendation, what clearly highlighted Kayla was her commitment to clinical excellence, nursing scholarship, and the advancement of our profession. So it is definitely my privilege to introduce our first ever Early Career Achievement Award to Dr. Kayla Carr. Thanks, Kayla.
Thank you, Dr. Parnell.
Congratulations. I'm sitting here giving you an applause, and I am just in awe, Dr. Carr, of all of the accomplishments you've made to date. And we look forward to hearing a little bit more from you during our panel discussion. Congratulations again.
Thank you.
And Dr. Moore, now I get to recognize our Distinguished Alumni of the Year. Again, in January 2020, the Special Recognitions Committee met to discuss the Distinguished Alumnus or Alumna of the Year award for 2020. Recall that the 2020 was the year that the World Health Organization declared the Year of the Nurse. So we had every intention of making 2020 Alumnus of the Year a very special occasion. Obviously, we know what ensued in the month to come. So for 2020, we selected someone who was perfect as the Distinguished Alumnus of the Year during the Year of the Nurse. And honestly, I believe that when this nomination emerged, I could say, and everybody in the committee agreed, that there were a few elite individuals among our alumni who have made such an impact on healthcare in Mississippi and abroad. You've probably already read the program, so there's no need to build up to the suspense. Mr. Chuck Stokes, who received his Bachelor of Science in Nursing from UMC School of Nursing in 1977, was unanimously selected to be our 2020 Alumnus of the Year. So now, here we are in 2021, and we did not get to recognize Chuck during the Year of the Nurse. Since the Year of the Nurse was dominated by quarantine and event cancellations, we decided to, for the first time ever, award Chuck back-to-back years as our Distinguished Alumnus of the Year. So Chuck is our first ever 2-time winner of the Alumnus of the Year for 2020 and 2021. So a little bit about Chuck. It's interesting when I was forwarded his bio, which I knew a lot about this already. It also included an excerpt from an article that I think some of you will find touching, because it also highlights another one of our alumna that's probably on the call right now. So Chuck grew up in Yazoo City, Mississippi. He worked his way through nursing school as an OR scrub tech and an ICU nurse at UMC. Dr. Janet Harris, who was one of our distinguished alumna, was head nurse in the adult intensive care unit at that time. And after spending several years as critical care nurse at UMC, Chuck expressed his intention of becoming a CRNA or nurse anesthetist. Chuck found his interest turning elsewhere. And he was more interested in how hospitals and health systems work. I can relate to that. I wanted to continue my clinical trajectory, but also got sidetracked into management. And now I don't consider it sidetracked. I consider it a very worthwhile career. Like many of us on the management trajectory, you kind of take that first shiny sounding title, and he took a night shift position as an assistant director of nursing. In 1981, Mr. Stokes left UMC for Birmingham to pursue his graduate studies to support healthcare management. Janet recalls, "I remember having a cup of coffee with Chuck before he left." She said, he said, my goal is to be chief operating officer within 5 years, because he loved hospital operations. Well, apparently, Mr. Stokes stayed on track. Over the subsequent years, Chuck became chief operating officer of 4 health systems. Chuck has served in executive roles at hospitals and health systems in Alabama, Arkansas, Louisiana, Texas. I personally remember Chuck when he was president of North Mississippi Medical Center, which now, and I believe back then, was the largest rural hospital in the country. And it is a multiple-year recipient of the coveted Malcolm Baldrige Award for Excellence. In 2008, after his departure from North Mississippi Medical Center, Chuck joined the Memorial Hermann Health System in Houston, Texas as their chief operating officer. In 2017, he was elevated to the role of president and CEO, where he led a $5.6 billion health system that included 19 hospitals, 300 diagnostic and specialty centers, and over 6,000 affiliated physicians. So in 2019, Mr. Stokes retired, but his effort for quality in healthcare did not stop with his retirement. The year prior, he and his wife established the enduring Chuck and Judy Stokes Endowment of High Reliability here at our School of Nursing at UMC. Chuck has been named one of modern healthcare's 100 most influential people in healthcare. And in 2021, he was awarded the Baldrige Foundation Leadership Award for Excellence. Chuck is board certified in healthcare management and a fellow of the American College of Healthcare Executives. Chuck was the 2017 chair of the American College of Healthcare Executive Board of Governors, which I don't know if he remembers, but I was in Chicago, went up and shook his hand on stage in front of thousands of people. Mr. Stokes credits his success to the UMC nurses who taught and worked alongside him. Again, Mr. Stokes is a 1977 graduate of our Bachelor's of Science in Nursing program here at UMC. And he is the first ever 2-year Distinguished Alumnus of the Year recipient of that award. Chuck, thanks a lot.
Hey,
Congratulations.
thank you. Thank you, Dr. Parnell, and good afternoon, everyone. And certainly I am honored and just overwhelmed to receive this award. And I think that anyone that ever receives these type of awards know that it is not just any one individual effort, but there's a whole host of people that support individuals that receive these type of awards. And I'm no exception to that. There are many friends, educators, mentors, and supportive spouses and family members that have all supported us along these journeys. And there's no one no more supportive than my beautiful wife, Judy, our 3 sons, Neil, Josh, Joel, and our daughter-in-law, Sherry. And I thank them very much because we just couldn't do this work if we didn't have supportive family members. There have also been the UMC family, and that goes back a long way. People like Dr. Edred George, Janet Harris, Florence King, Rose McKellar. And I could spend the rest of my time here talking about those individuals that influenced my career and the career of literally thousands of other clinicians and leaders in the organization. But I think Dr. Parnell's covered my career pretty succinctly, and so I won't dwell on that. My career started as an orderly at King's Daughters Hospital in Yazoo City. And it was kind of one of those things back in the 70s, you could do a lot of things as an orderly. And the doctor that actually delivered me, Dr. R.J. Moorhead, taught me how to scrub. So I would stay in surgery in the morning, and surgery was over by noon, and I would pass instruments for him. And I got intrigued with anesthesia because our CRNA was Geneva Pearson, and I used to tell everybody, I think she has put everybody in Yazoo County to sleep at least once. And I was pretty fired up about becoming a CRNA, which was the impetus for me to go to nursing school at UMC. But it's been a fabulous career. I obviously took a detour from being the bedside nurse to running healthcare organizations. But it all started at UMC. And so I retired in December of 2019, which was timing is everything. It was right prior to the pandemic. And I really, I empathize with all of my clinical and executive peers across the country that have had to deal with this horrible pandemic. But anyway, I am very appreciative of this honor. And my wife and I, what we do with our time now, my wife and I, Judy, we volunteer at the vaccination center in Huntsville, Alabama. And here we are at the end of our careers. Judy is a pediatric nurse practitioner, and she and I are giving vaccines to people. I never thought that I would be giving shots at 67 years old. And so, but you never know what happens. But I'm teaching for ACHE. I'm also executive in residence at UAB, and I enjoy that role very much. What I want to talk about today is just take a few minutes to talk about some of the future trends in healthcare that are going to affect our nursing programs, how we educate nurses, and what nurses are going to be doing in the future as well as where our industry is headed. And I've been watching this and being a participant in this for over 40 years now. And so one of the things, the first trend that we have to come to grips with is the aging of our population. And many of you have probably heard the statistics. There are over 10,000 people a day turning 65 years of age. And those individuals are going to end up living with 2 to 3 chronic conditions for the rest of their life. And now with the pandemic, those individuals, we've got long haulers with the pandemic that are going to just add to that chronic disease process. And so we're getting ready to consume more healthcare resources than we've ever consumed in the history of the country. And that comes on the heels of the second issue that we're having to deal with in our industry is workforce shortages. And so when I think about workforce shortages, I go back to when I was right out of nursing in 1977. University Medical Center, we were recruiting nurses all over the world. We were in the Philippines, we were in Canada, we were in England, we were offering all kind of bonuses. And recruiting nurses and the nursing shortage, I don't think has ever been really mitigated or dealt with in the 40 years that I've been in healthcare, because every place that I've ever been in 7 different organizations, we have always been recruiting nurses. But also, what we find ourselves today also with a shortage is primary care physicians. And that's one of the reasons that you're seeing a lot of nurses go to back for advanced nurse practitioner training, is because we have to do something to be able to take care of all these people that are turning 65 every day. And the same is applicable for other allied health professionals, whether it's pharmacy, OTs, PTs, respiratory therapists, et cetera. And it's really becoming a crisis. And I think post-COVID, we're going to see some really pretty serious spillover as the workforce shortage is exacerbated because of people retiring and people leaving the bedside to just take an emotional break from the pandemic. I think one of the other things that's very disturbing about our workforce is I saw an article about a year and a half ago that said somewhere between 37% and 54% of nurses and physicians were experiencing significant symptoms of burnout. And so we're going to have to deal with that as an industry, and that is going to be very challenging. And the cost of care would be probably one of the third trends that we've been fighting for over 2 decades now. We're spending 18% of the GDP of our country on health care, and that's twice as much as the next industrialized nation, and we still don't have the best clinical outcomes as other nations. And so a couple of things about the cost of care that I think is really driving that up is there's a statistic that we've used for many, many years about unnecessary care or overutilization of services. And a lot of people feel that that number is somewhere around 30% of the care that we provide in this country adds nothing to the health status of improving the health status of people that those services are provided to. And that's a fairly staggering number when you think about it. And one of the things that I think we have seen as a result of COVID is that number will be ratcheted down, and a lot of that business will never come back to hospitals or surgery centers, et cetera. The other thing, and this is a personal bias that I have about the cost of care and dealing with end-of-life care, we have done an abysmal job in this country of dealing with end-of-life care, and it's only been exacerbated by this pandemic that we're dealing with. Pharmaceutical costs, mental health services, we've never made the investment in mental health services that we've needed to, and we're going to have to figure out how we deal with that. And pharmaceutical costs are just out of control. And hopefully between this administration and a lot of efforts on the industry, we can drive those down. And the other trend that's coming of age, and it's not coming of age, it's already here, is how we deal with artificial intelligence, genomics, and robotics. Because when you look at artificial intelligence, we are doubling our capacity in artificial intelligence every 18 months. And so when you see treatment algorithms or clinical-based care, that is what is going to drive this for the future. And you're going to see, as a result of artificial intelligence and these new algorithms, that nurses are going to be front and center of implementing these new algorithms as we move forward in time. And then one of the things I'm very passionate about is the whole issue around high reliability, quality, and the safety of care. Prior to COVID, death from medical error was the third leading cause of death in the United States. Now that is, if you ask anybody on the street what the third leading cause of death, you would hear something: cancer, diabetes, heart disease, or something like that. But it was death from medical error. And the numbers at the low end of that, spectrum, is about 242,000 people a year die because of medical harm and medical error. And that number in some papers goes up to as high as 400,000 people. And the metaphor that I like to use for this is, it is the equivalent of a fully loaded 737 airplane crashing every 4 to 6 hours in the United States. Now, we know that if that were the case, if a 737 airplane was falling out of the sky every 4 to 6 hours, there would be no planes flying until a root cause analysis was done to figure out why planes are dropping out of the sky. So as a country and as an industry, we're going to have to really redouble our efforts on patient safety and how we prevent death from medical error in this country. And the transparency and reporting is not going to allow us to hide behind these numbers and that statistic in the future. And one of the things I'm always proud of nursing, because nursing has always been served as the patient advocate, and they're going to continue to serve as the patient advocate. And nurses are the ones that are going to tell physicians that if you don't mark the site, if you don't do a timeout, you don't introduce yourself, you don't do 2 provider checks and those kind of things, they're going to call you on that. And we have to continue to do that, because becoming a high reliability organization is everybody's job. It's food service, it's plant operation people, it's the registration clerk in the lobby. It's everybody's job in the organization to make sure their organization is a high reliability organization. Now, one of the things, another trend that we're going to have to figure out how we're going to educate our workforce for the future, because what we know now is we do not have enough faculty to teach nurses. We do not have enough nurses in the pipeline to really take care of this 10,000 people a day that are turning 65. And so what are we going to do if we don't have enough today, and it's only going to exacerbate in future years? How do we mitigate that? How do we put a new program in place? And so it's not about nurses practicing at the top of their license. We hear that all the time. I've heard that for the last 5 years. It is about redefining the license. And your BSN nurses are going to have to redefine what their skill sets are. The advanced nurse practitioner are going to have to do the same thing. And physicians are going to have to do something very similar. And so I think as more BSN nurses become advanced nurse practitioners, that just creates a problem at the bedside, because we're seeing our brain trust, our talent at the bedside going into these advanced nurse practitioner programs, because we don't have enough primary care physicians and we don't have enough nurses providing advanced nurse practitioner skills. And so that will continue to happen. So if that's the case, and we're losing nurses at the bedside and we can't train enough in the schools because we don't have enough faculty or we don't have enough financial support from other organizations, we have to come up with Plan B. And I'd like to say I know what that Plan B is, but I really don't. I have some ideas on that. And I think that one of the ideas is that we're going to have to get healthcare individuals that are interested in healthcare professions engaged in high schools. We need to start in the 9th, 10th, 11th, 12th grade. And I think if we really focus on educating these people in the 11th and 12th grade, by the time they graduate from high school, they can have a job that's earning a living wage. And most healthcare organizations, once you get into their organization and you're a productive employee, they'll send you back to school to get your BSN degree or your master's degree or advanced nurse practitioner degree if they have a need for that. And so one of the areas that I think that nursing is really going to excel in the future is in home care, in the home care setting, because I think nursing will actually own the home care setting in the future. You can't take a $70,000 or $80,000 a year nurse and send them out to somebody's house 3 days a week. That's not financially practical or possible. But you can train nurses, BSN nurses, or a nurse technician and arm them with technology to go into the home setting and work with advanced nurse practitioners and teaching the patient and the family member how to care for those individuals and pushing all that information back into the electronic medical record. But I think that's a great opportunity for nurses and nurse technicians to continue to acquire the skill sets to have them advance in the practice of nursing. I think the seventh area that we have to work on is our commitment to diversity, equity, and inclusion. Women make up 75% of the healthcare workforce, and in a lot of places it's more than 75%, but have never been on parity with male counterparts. And it doesn't matter what part of the country you're in, this is applicable to all parts of the country. And it's no longer just good enough to say diversity is my workforce, does it mirror the community? Diversity is about having a seat at the table. Inclusion is about having a voice at the table, but belonging is about having that voice heard. So my point is we're going to have to focus on that. And that's where these solutions come from, is by embracing diversity, equity, and inclusion. Our frontline workers are the best people in the world to tell us how we are going to solve this problem. And today, one of the issues about diversity, equity, and inclusion is about our employee engagement. And Gallup released a poll in the mid-year of 2019 that said only 37% of the workforce is actively engaged in their work. Now, that is a staggering number, because to me that says 63% are either moderately engaged or not engaged at all. And the implications for that in terms of lost productivity, in terms of error, patient harm, et cetera, is staggering. And we're going to have to address that. That was prior to the pandemic. And when you think about that, if you got on an airplane and the pilot, you get in your seat and you get all buckled in and everything, and your pilot comes on and says, you know, I really had a bad night last night. We had a big party and I got home late, and I'm only 37% engaged in getting you on your vacation here, getting you to the next town. I think most of us would have a panic attack if that were said. And so we have to think about the implications of the workforce and where that's going for the future. But the good news is nursing is still a fabulous career, and the opportunities are endless. You're going to be running health systems and hospitals for the future. In ACHE, nurses and physicians are the two fastest growing segments of healthcare, of our membership, of healthcare membership in ACHE. But the people that are coming after our nurses are biomedical companies, pharmaceutical industry, artificial intelligence companies, technology companies, consumer-centric care, home services, and running large physician groups, ambulatory groups, and post-acute care facilities. Those are enormous opportunities. And when you think about healthcare being a clinical enterprise, who better than physicians and nurses to run the clinical enterprise? So you're in a fabulous career. It's going to continue to be fabulous. We have our challenges ahead of us, but none of these challenges are insurmountable. And so you will never lack for a job or an opportunity to work if you're in nursing. And so again, I'm going to close here with thanking you for this honor. I am humbled by this. And thank you for being here and participating in this today. And at this time, I'm going to turn it back over to Dr. Moore.
Mr. Stokes, thank you. Your words that you shared were very insightful. If you could have seen me here, I was literally peered in and hanging on to every word. You had a lot of things to say, taking us down briefly from a historical perspective, our current state, and definitely future trends. And I look forward to the next phase of this hour, the next half, I should say, of this hour with a discussion, because I think I could have a lot of questions, but I really want this next half of the hour to be an engaging session. And for all of our attendees, what we designed for the remainder of the time is to bring in a very diverse group who represents various areas in our nursing profession, as well as Mr. Stokes mentioned diversity. Very diverse group, diverse in every area, geographical locations of work, race, gender, age, etc., even in a student perspective. So at this moment, I would like to ask our panelists to show themselves. Let us see you. Turn your cameras on. And for the attendees, I would love for you to participate and engage with us during these next several minutes by sending us questions through the chat. So you should see the chat option. On my computer, it's my bottom right side. So you should see that on your computer or your device. Look for the word chat and simply submit a chat. The questions will come directly to the panelists and we will respond to those. And they could be anything that Mr. Stokes has covered. If you are interested in hearing something that he may not have covered, please ask us in the chat or any of our panelists. So to begin, I did mention that we have a very diverse panel, including Mr. Stokes and Dr. Carr, who is our Early Career Achievement Award recipient. And we heard a little bit about Dr. Carr's bio. We'll come back to Dr. Carr momentarily. But I also want to represent or present, I should say, our alumni representative, and that's Mr. Sanders Coley. Sanders, will you just give us a brief 1 to 2 minute intro of yourself, the year that you graduated from our program? Let us know what you're doing today.
Sure. Thank you. My name is Sanders Coley. I'm an actual 2018 graduate of the School of Nursing there, so not very far removed, but I represented the School of Nursing amongst the other alumni representatives as a star. I was also the president of the student nursing body. I currently work at Oshner Medical Center main campus here in New Orleans, Louisiana. As a staff nurse with the surgical ICU, I am also a representative of the resuscitation committee as a rapid response nurse for the system. And I'm also a recent graduate of Belhaven School of Business with my master's of business administration. So I keep myself busy, but I'm always happy and honored to be here for the School of Nursing and the place that gave me so much. So thank you again for having me.
Absolutely. Thank us for that. And yes, you were a star student when you were with us, and you're still a star nurse now. So all of your leadership roles are very impressive. We look forward to hearing more from you.
Absolutely.
Our student representative, Ms. Stone, Riley Stone, will you please give us a 1 to 2 minute introduction?
Hey, Dr. Moore, thank you so much. I'm so happy to be here with you guys. So currently I serve as a student alumni representative with the Alumni Affairs Office. I also serve as the Nursing Student Body Philanthropy Chair and ASD's Communications Chair. I'm set to graduate this month, actually, and I have accepted a job in the surgical ICU here at UMC. So I'm very thankful just for all the opportunities I've had through the School of Nursing and through UMC, and just very grateful to be here with you guys today.
Riley, congratulations on achieving this wonderful milestone with your upcoming graduation. We are so proud of you, and we are very proud of your leadership roles in the School of Nursing. As a student, you wear many hats, so thank you for that. We will hear more from you momentarily. Now, Dr. Carr, we heard a lot about you through Dr. Parnell's introduction. Please share something that Dr. Parnell did not share with us.
I am an assistant professor in the accelerated program and have enjoyed doing that since 2014. It's funny when Dr. Parnell, I'll call him Michael because we went to school together, but was reading the criteria for this award, I just kept thinking, who is that? Who would that be? So I'm really humbled and really honored. I just feel like I've been working night and day for the past 12 years or so. So thank you so much for this honor. I recently took a role as the director of our Jackson school-based clinics, and I'm loving being with patients and students in the clinical setting again. And I'm involved in all kinds of fun projects at the School of Nursing, where I was kind of grown. So I'm happy to be here today.
Thank you, Dr. Carr. So I'm watching the chat box. Please feel free to ask us questions. Mr. Stokes talked a lot about the pandemic and the impact that COVID-19 has had on the workforce. So I want to start there, and I know we won't stay here very long because I feel like there's a little bit of pandemic fatigue right now. I do feel that our experiences are real, and it's nice to understand what each individual person has experienced that might lead to resiliency. So that's going to be a later question that I'll have is about resiliency. But I would just like to hear from first Riley, because she is a student who has had an incredible opportunity to jump in clinical experience during a time that most students don't. And then after we hear from Riley, I'll toss the same question to Sanders as a nurse within 3 years of his career. So the question is, how has this pandemic, COVID-19, how has it impacted you personally and or professionally? Just tell us one or two coping mechanisms that you have in place based on the impact that the pandemic has had. So Riley, I'll toss it to you first.
Thank you. So it was definitely challenging last spring. I was on a medical mission trip over spring break, and when I came back and had phone service, everything was shut down, and we were going to be online for the rest of the semester for school. So it was definitely challenging getting back in the routine of nursing school and finishing that up online. But for me, I really cope with things by getting involved and just finding my place in the situation. So for example, last spring, I was on the student lead team that gathered volunteers for the initial round of COVID testing at the Jackson Fairgrounds site. So that's something that I did to kind of get involved and help me cope and have an understanding of what was going on in our country and our state, specifically the Jackson area. So I've done that. Also, just being very inclusive with all the students and just checking in on each other. We have a student group message where we keep in contact and we share struggles. So that's been very helpful for all of us, I believe, is coming together and just being united and knowing that we're all going through the same thing. And to know that despite everything, here we are a year later and we are set to graduate this month. And for the most part, we have all persisted on. And I believe we have a class of the upper 90s set to graduate at the end of this month. So it's been a very awesome opportunity to be part of this. And I think we're going to have a story and an experience to share once we get started.
Absolutely. It's interesting you mentioned story. But right before we started this event, I was thinking about each of our stories, and we each have a unique story, just like our fingerprints, if you will, is unique to our own experiences. And we'll definitely be able to share our story during this pandemic and beyond in the future. And thank you for volunteering. You know, that is an awesome way, service. And as nurses, we definitely serve. Sanders, what are your thoughts?
Well, we here in South Louisiana had the unfortunate experience of a very early exposure to COVID due to Mardi Gras in early 2020, and we didn't really have the resources that we needed at the time because our population of COVID patients really exploded. So we didn't really have a lot of I guess, coping skills on the front end. However, the nurses and the entire team here, we really mobilized everyone that we could, and we saw a lot of things that we never thought that we would see. However, we saved a lot of lives that would have ultimately not survived if it weren't for the hard work and dedication of the team here. But I think we're still going through it, and we're kind of starting to kind of come down on our adrenaline rushes and really realize the impact that we've taken on mentally as a result of the pandemic. So I think it's going to be a more long-term solution, and it's nothing that we can get over within the most immediate period. However, I can proudly say that we've closed our COVID ICUs and we're down to one floor. So I think we've done an amazing job along with everyone else in the healthcare system nationwide and worldwide in trying to tackle something that we as healthcare providers never thought we would see.
Yeah, those successes are important to identify. The fact that your institution, as well as many institutions across our country, had to quickly react and respond by identifying specialty units for COVID patients. And now we are getting to the point where we can return those units that were created for COVID back to their normal state. And that is a point of celebration, if you will. Even if we don't actively celebrate, it's something to be noted. I do have a couple questions. Go ahead. Okay, I do have a couple of questions in the chat box. This one is to Sanders. Is there anything that you can identify that you were not prepared for in the workplace?
Not specifically, Dr. Moore. I think my education process there at UMMC was superior to anyone that I joined the workforce with. I proudly stand behind my education and the school that I went to. And it oftentimes gets me into a lot of arguments with a lot of the LSU alumni here. But I think that I was adequately prepared for my role here that I've served in, and it's ultimately given me a lot of the tools that I've used to do up until today. Even I think that the education there is second to none, and I'll always stand behind the place that I've grown to love over the past years.
I know our dean is very proud to hear that, and I'm looking in the chat box and I can see comments from Dr. Northington. You know Dr. Northington very well, both you and Riley. She's very proud of both of you. So thank you for serving on this panel right now. So this one is, let's see, I'll just read it here. Understanding there is a shortage of bedside nurses. Is there any discussion for leaders to move closer to the bedside? As a society, we push furthering education and creating leaders. However, that can be counterintuitive with the shortage for nursing and ancillary staff. So I will toss that one over to Mr. Stokes.
Sure, thank you. Well, as I mentioned earlier, I think that one of the things we're going to have to do is we're going to have to start getting youth involved in healthcare much earlier than college. And I think that there's an opportunity for us to take students in their 11th and 12th grade of high school and put a curriculum together where they can go to school from 8 o'clock till noon and satisfy the requirements to graduate. But maybe in the afternoons that they go to a nursing program where they are trained for 2 years in the evening so that when they graduate, they can come out and make a living wage, and we can increase the supply of nurses. And the other thing is, I think that we're going to have to just have a more sophisticated nurse, and I'll use the term nurse tech. We're going to have to train them to do skills that have traditionally been performed by BSN nurses, registered nurses, so that it'll free nurses up to do the more assessments and response to treatment type evaluations, and give them more time to do that. And so I just think we have to rethink, and it's not only for nursing, but all allied health professionals. We need someone that can take some of the more mundane technical type things that can be done by someone else and train them to do that. And that'll be a big shift for the education and academic curriculums as well as high schools, because getting high schools to change their curriculums to accommodate that is that's another challenge. But if you don't have enough nurses and you don't have enough professionals to treat the growing number of cases that they're going to have to be dealing with, then somebody has to say, we have to develop Plan B. And I think Plan B is a consensus of educators and practicing nurses and other allied health professionals to say, what kind of individual can we train to help us out as we go forward? Because it's not going to get any better for the next 20 to 25 years. And so we have to come up with Plan B.
Yeah. Historically, it seems like we've had a very similar model to what you're describing, Mr. Stokes, in terms of engaging high school students, but they've been at the licensed practical nursing level. And I've not seen that necessarily at the registered nurse level. So perhaps that's a model that we can look at and modify to fit that expanded role.
And I think that's a great point. And at the licensed LPN level, to get them the skill set so that the day they graduate, they can move into the workforce. Because as I said, one of the things that most healthcare organizations will do is, if you're a good employee, they will pay your tuition to go back to school and to get a BS degree or a master's degree. And we just need more emphasis on the high school folks and getting people in the pipeline to be trained.
Exactly. I will toss this one to Dr. Carr. And then if Mr. Stokes or Sanders or Riley want to chime in, feel free to. So this one is a question, I'll just read it. We are finding ourselves limited with the number of areas for clinical rotations as well as preceptors. Any ideas how we can get creative while maintaining a robust, ongoing process and clinical and quality clinical rotation experience?
Thank you. That's a great question, and something that we have lived with in the accelerated BSN program for a long time, as we try to prepare our students. And I think it all starts with that academic practice partnership. I love that phrase about bringing leaders back to the bedside. I think leaders are already there. And I try to tell each of my nursing students, the answer is not always, let's go to nurse practitioner school when you see a leadership problem at the bedside. And so I think we have to get creative about what the needs are of academic institutions and clinical institutions, and work together so that we can meet both of those needs. I also love the idea of being creative with what nursing is. Sometimes we can really get very focused that it's inpatient med-surg nursing, which is absolutely critical and important for passing the licensure exam. And there are also a lot of nurses in the community doing population health and working in health departments and responding to the pandemic and in leadership and management. And for me, those are skills that a BSN prepared nurse needs to leave with. So Being creative about clinical placements, I think, is another piece. The third thing I would say is high quality simulation. We have really gotten good at simulation at the School of Nursing. Even in my time here, I have just seen things take a complete 180, and we really value high quality debriefing and feedback for students in a safe environment. And I think that can really expand a student's clinical judgment. So we have a lot of work to do, but we've made a lot of good strides there as well.
Absolutely. So thank you. Yeah, you brought up a lot of great suggestions on how we can continue to modify, if you will, our experiences with students and preceptors. And the simulation goes hand in hand with the technology piece, artificial intelligence that Mr. Stokes spoke of when he presented to us early on. When we think about our current workforce environment, and the baby boomer population that's retiring, getting older, living longer. Mr. Stokes mentioned this as well in terms of the future trends with healthcare. And when we consider diversity, inclusion, belonging, today we have about 5 different generations in the workplace. There are a lot. This panel, if we put all the individuals on this panel on a nursing unit, we could literally represent 5 generations. Considering that we do have 5 generations in the workplace, describe one opportunity and one challenge of how this impacts our work environment. And we can consider both hospital settings or academic settings. Anyone who wants to take that question.
Well, I'll jump in. I think that regardless of the generations that we have, again, with these 5 generations that are coexisting at the same time, what employees want is they want to feel that their voice is being heard. And it doesn't matter which generation you're in. And that's something we don't do a good job of that. And historically, we haven't done a good job. And we realize the importance of it now, because the thorny problems that really affect healthcare and coming up with new models of care and how to engage employees. No one can give you a better assessment of that than the person that's actually doing the work at the bedside. They're the one, it is not the C-suite people that are in the administrative suite trying to come up with answers to this. If the C-suite people will get out of their office and go to the departments and to the nursing units and to other areas of the hospital and just ask the employees, what do you need to provide world-class patient care? They will tell you. They will tell the administrator to do that. We just don't do that well enough. And the engagement piece, that's a real scary piece for me when you think about 63% of the workforce being only moderately to not no engagement at all. That's why we have as many harm events as we have across the country. And if people feel like that their voices are being heard, they have to say so in the mission, vision, and value of the organization, they'll be more engaged and they'll be more receptive to change.
Absolutely. We have a little less than 5 minutes remaining in the hour. What I would like for you, the panelists, to do, and I want to pause and again thank each of you for sharing your time, sharing your talents with us, and being willing to showcase to this group of attendees what nursing means to you. You've demonstrated that already, even as a student, Raleigh, to now a retired CEO. So we appreciate that. I love to have takeaways. And so as we close, I will ask each of you to leave us with one takeaway that will inspire us to continue our calling in this world of nursing that we have been selected to lead, or we purposely chose to work in this space. So I'll start with Riley, our graduate. Leave us with one inspiring message.
So I think something that I've been able to see over this past semester, being in synthesis and with my preceptor in the surgical ICU, and something that Mr. Stokes talked about was just the burnout of nurses and just what this past year has done. And while that is true and disheartening, at the same time, there is graduating classes eager to start and take up and pick up the great legacy that's going to be left by the nurses that have came before us. And I think that's just something very inspiring to look at. And it's great to see leaders such as all of you to follow in the footsteps of. And then we have a great set of prior nurses before us to learn from and to hopefully have mentors for us. And it's good to know that, yes, there are heartbreaks and there are routes from previous workers, but there are also groups who are ready to start and have never had the experience and we're ready to pick up where everyone else is leaving off. So I think that's something exciting to look forward to.
It's very exciting. Thank you. Sanders?
I'll piggyback off of what Riley said. I think that it's undoubtable that, and it's irrefutable that the decision that we've all made to become nurses is destined, and we all joined the workforce to make this profession better than it was and when we joined. And I think as long as we continue to have those goals and we have these talks and we continue to acknowledge the problems that we face, we'll continue to figure those problems out. And I think that it'll remain the great profession that it is.
I like that. We have to continue to acknowledge the problems that we face. Absolutely. Kayla?
I think I'm at a point in my career where I look back on some successes and failures, and I'm kind of grown into my own and figuring out an identity for myself as a nurse. And when I look back, the pattern that I see is just do something. So if I waited until everything was perfect or until I had every skill that I needed to tackle a project or a problem, I probably would do nothing. And so what I do see when I look backwards is opportunities that came my way that were challenging and imperfect, and maybe I didn't know what the end would look like, and it was a very big risk, and I just kept going forward. And on the other side of those things, you've either accomplished something wonderful for your patients or the profession, or you've learned a lot. And so you really can't lose if you just keep going forward and just try. So it's a little simple, but I hope that helps someone.
Yes, thank you. Mr. Stokes?
And I would just say, just keep the patient the center of the universe in healthcare. That's and do the right thing with the patient always being at the center of the universe. I saw a quote the other day that said, always find the time to do the things that make you happy and to be alive. And we got to think about ourselves. We have to keep our own physical and mental health in good shape so that we can care for others. But I think keeping the patient at the center of what we do is the most important thing.
Absolutely. Each of you are inspiring and trailblazers, and we're very proud that you are role models in our nursing profession. Again, I want to thank you for your time. I do want to now hand over this last few minutes of our event to Megan James. Megan?
Thank you so much, Dr. Moore, and thank you for our incredible award recipients and speakers. My name is Megan James, and I serve as an Alumni Engagement Associate in the Office of Development. As we conclude today's program, I want to thank our event attendees for continuing to support your alma mater and the initiatives of the School of Nursing. We could not reach our goals of excellence without the continued engagement and support of our outstanding alumni community. Following today's program, an email will be sent congratulating Kayla and Chuck. You will find a link in that email, and that will allow you to virtually high-five the award recipients by making a donation to the school. Additionally, we would love for all of our alumni to update their contact information and consider volunteering to serve on an alumni panel such as this one, or perhaps even volunteering to serve on the alumni board. So again, congratulations to Chuck and to Kayla. We thank all of our alumni and friends for attending today's program, and we wish you all a wonderful Nurses Week.
Thank you.
Thank you.
Thank you.
Thank you.